at the session. I'm really sorry that there was slight delay because of the technical issue, but we are on the right track now, and I request Lakshmi, Patil, and Rajan, Anand to take over. Thank you.
Good morning, sir. Good morning, sir. As I introduced Dr. Gegal Pruthi, she is an assistant professor at AIMS, Bathinda, and she has 10 publication, national and international publications. And since it is a time concern, I would like I'll ask her to go ahead with image optimization and knowledge. She's going to elaborate us with this. So, thank you.
Thank you, ma'am. Shall I start?
Yeah.
Yes.
Start, ma'am.
Are my slides visible?
Yeah.
Yeah, your slides are visible.
Okay. Good morning, everyone. Thank you, Muralidhar sir. And I would like to start with the Knobology and the image optimization. So my presentation will include, first of all, the basics, that is sound waves and its interaction with the tissues, and then Knobology and image optimization. As we know that the human hearing range is from 20 hertz to 20,000 hertz, and frequencies above the hearing limit are known as the ultrasound. Now, how these echo images are formed? The echo probe has piezoelectric crystals. These convert mechanical energy into electrical energy, and the reverse piezoelectric effect is that electrical energy gets converted again into the mechanical energy. So in ultrasound machine, when you apply the electrical current, the crystal vibrates and thus generate your ultrasound waves. And these ultrasound waves then again convert back into the electrical energy in the form of ultrasound. Now, how the 2D echo images are formed? They are formed with the help of the phased array probe. These phased array probe, in this, all elements fire simultaneously to form one beam. These beams then steer little by little. These beams steer little by little to sweep an arc or a sector. And final sector image is formed after one complete sweep. The ultrasound wave goes and interacts with the tissues in the form of reflection, refraction, scattering, and the absorption. Attenuation is loss of intensity, and it is due to dispersion or absorption in the form of heat. What is scattering? Scattering is when ultrasound waves goes and hit some irregular structures such as RBCs, and thus results in the scattering. The main echo images which are formed, it is because of the reflection. So when sound wave propagates through uniform media, they follow the straight course until they meet another structure with different acoustic impedance. There they can be reflected back or move in the different direction. So the optimal return of reflected wave occur if the structure of interest lies at the perpendicular angle. If the structure of interest is perpendicular and the waves are coming at the perpendicular direction. So coming to the Knobology, we know we have in TE probe, we have bigger wheel which is used for antiflexion and retroflexion, smaller wheel for sideway movements, and also omniplane controller for changing the angulations. So the larger wheel is used for anti and the retroflexion. Smaller wheel is used for left and right flexion. Different types of TE machines are available and different knobs are present which we should know. First of all, you have to turn on the universal power on and off button. And then after turning it on, the next most important step is to switch to the correct probe. So different probes have different frequencies. So different frequency probes which are available. If you have a higher frequency probe, you will have more resolution. And if you have a low frequency probe, you will have less resolution. Now coming on to the resolution, what is resolution? We have two types of resolution. Spatial resolution and the temporal resolution. What is spatial resolution? Spatial resolution is ability to discriminate between two closely spaced objects, and it is in the form of axial resolution and the lateral resolution. What is axial resolution? Axial resolution is ability to discriminate between two closely spaced objects in the y-axis, And what is lateral resolution? It is ability to discriminate between two closely spaced objects in the x-axis. Now, as we already know that higher frequency probes will have higher resolution. So how it is possible? Because if you have increased frequency, as frequency is inversely proportional to wavelength. So increased frequency will have shorter wavelength, as we can see in the figure B. Increased frequency will have shorter wavelength. If you have shorter wavelength, there will be more wave to tissue interaction. So more wave to tissue interaction means more data can be collected from that particular site. So therefore you will have higher resolution. So increased frequency probes will have higher resolution. But higher axial resolution, it doesn't come for free. If you have a more interaction and more data is being collected, you will lose power also. So you will have attenuation from the deeper structures. So for better resolution, you have to use increased frequency probes, and also your region of interest should be in the near field. Whereas if we see the lateral resolution, if you see figure A and figure B, in which there is hypothetical scan lines, there is 10 scan lines in the figure A and 20 scan lines in the figure B. So increased scan lines per frame will lead to increased lateral resolution, because they will be able to process more of the lateral image quality. So increased scan lines means you will have increased lateral resolution. Now coming to the temporal resolution, first we should know what is frame and a frame rate. Each image is created by a sector. So one sector is known as each image created by a sector scan is known as a frame. So this is one frame. So how many times this frequency at which it is rescanned, it is known as the frame rate. And it gives information, the temporal resolution gives information about the movements. What is temporal resolution? It is to rapidly display the moving structures and distinguish closely spaced events in time. So it depends on the time required to generate one complete frame, which is one particular scan. So hence temporal resolution is closely related to the frame rate. But temporal and lateral resolution are not friends. When you have more beam, when you have in figure B, we have seen that there were more beams. For example, 20 beams, 20 scan lines are there. So if you have more beams coming up and down, it will take longer time to finish one complete sector and then to start a new frame. So anything which requires more time, like the deeper sector, lesser will be the temporal resolution. So if you have more lateral resolution, the temporal resolution here will be lesser in figure B. And heart, it is a moving structure, so higher frame rate will improve the temporal resolution. So after you have selected the correct probe, now you have to choose the correct application preset. Each transducer, it has a different list of application presets based on frequency and footprint that will automatically select the ideal frequency, depth and gain for that application. It is similar to selecting your day mode and night mode on your phone cameras. So after you have turned on the power button on, switch to the correct probe, application preset also you have done. It is very important to have attached ECG and enter the patient details, because it will help in the data propagation. So now after you have you have switched on the machine, you will automatically have your 2D mode on, which is the mainstay of the echocardiographic examination. It directs the ultrasound pulses across a 30° to 90° of the sector of the cardiac anatomy. And this process is repeated to update the image and capture the motion. Coming to the M mode, it displays superior display of the dynamic motion and the temporal resolution, as it is a series of collected B mode images from single scan line. So you have single scan line. So therefore, you will have higher temporal resolution in the M mode. So the frame rate here is more than 2000 per second. Therefore, it is very good for examining timing of the cardiac events with the ECG. Coming to the image optimization, firstly you should know how many cycles you should take. If you have no arrhythmia or tachycardia, a single beat acquisition is enough. But if you have arrhythmias or tachycardia, 3 to 5 beats should be acquired. What are the prerequisites for an optimal image? The patient should be calm, relaxed, cooperative. We should avoid cautery while acquiring images, and we should decrease the ambient light. For optimization of image, we should know about the depth, zoom, gain, time gain compensation, lateral gain compensation, focus, sector size, and also some Doppler optimizations. So what is depth? Depth of penetration is depth is simply how you want the ultrasound machine, how deep you want the ultrasound machine to be able to scan. And it is denoted in the numbers on the right side of the screen. So depth should be adjusted to include the region of interest. Otherwise, if you have too much depth, there will be wastage of the information, which will decrease the temporal resolution. So after adequate depth, if required, you should zoom in the region of interest. So zoom is better for valvular morphology, pathology, and relatively small pathological masses such as vegetations. Planimetry measurements will be more accurate if we are doing it on the zoomed images. So zoom magnifies there is no change in the resolution of the selected region of interest, even if we are magnifying or using the zoom. Coming to the gain, there are three types of gain: overall gain, time gain compensation, and the lateral gain compensation. Gain is to increase the amplitude of the electrical signals generated by the ultrasound signals. And gain is applied on the 2D images, color Doppler, and also the spectral Doppler. Now, if you can see, increasing the overall gain of the imaging system, it compensates for the signal loss due to attenuation. So gain has to be adjusted such that your blood looks black, myocardium gray, and your pericardium as white. As if you are using high gain, as you can see in this figure, if you are using high gain, there is lot of noise. But if you are using low gain, you cannot visualize any structures. So optimal gain is very important, and it should be set at minimum level and then increase incrementally. And eliminating operating room light, it also helps in preventing the high gain. In too low gain, you will miss some low amplitude signals such as LV thrombus. Now, what is time gain compensation? Time gain compensation is called so because it compensates for the attenuation of ultrasound energy with the depth. As the structures are deeper, they receive back a weaker signal and also reflects weaker signals. So for compensation, we use time gain compensation. So you use a step ladder pattern mostly, which is automatic in some machines, because in step ladder pattern you'll be able to see higher settings will be used, and therefore you will be able to see far field structures better. Time gain compensation, you can see the far field structures as you can see in this figure, as you have used the step ladder pattern, and far field structures are better seen than this figure A. In lateral gain compensation, you selectively amplify across the width of the image display. It helps in improve view of the mainly the left ventricular lateral views, and it helps in detection of the endocardial borders. Coming to the focus, as we know, as the beam propagates, it will diverge and lose the lateral resolution. So that is why we have to use focus at the area of interest. You have to use the focus at your area of interest. As focusing, it further narrows the beam. So when you are just focus, you are simply concentrating your ultrasound at a specific depth, of the image to maximize the resolution at that particular depth. Coming to the sector size. So sector size, if you reduce the depth or the width, reducing the depth or width reduce the time required for scanning and the amount of information that requires processing. So this decreasing the sector size or depth, it will increase your frame rate, and therefore it will improve the image quality. Now, after you have optimized the image, you can freeze the image, you can measure the distance of specific structures, and also you can save an image or video clip. Coming to the spectral Doppler. So what is spectral Doppler? When Doppler signal is represented as velocity over time, it is known as spectral Doppler. It can be either pulse wave or the color wave. In pulse wave Doppler, you have a sample volume. So therefore, you determine the velocity at a pre-specified location. As there is only one crystal in the pulse wave Doppler, so this one crystal only sends the pulse and receives it back. What is pulse repetition frequency? The pulses transmitted per second is called the pulse repetition frequency. And Nyquist limit is the maximum frequency limit that can be accurately interpreted. And Nyquist limit is half of the pulse repetition frequency. So understanding aliasing. In aliasing, you will not be able to determine the velocity and direction of flow. So understanding with this example, if we know that pulse repetition frequency is, if it is 11, so Nyquist limit is half of the pulse repetition frequency. So here it would be 5.5 because pulse repetition frequency is 11. And if you have frequency of 3 and Nyquist limit is 5.5, so the maximum limit which you can determine is 5.5, but your frequency is 3, so there will be no aliasing in this figure. But if you have in this figure, if you can see, if your frequency is 8 but your Nyquist limit, which is the maximum limit which you can determine, that is 5.5, then your aliasing will occur and you will not be able to see the proper velocity and direction of flow. So if we can increase this Nyquist limit by either sending the decreased frequency transmitted waves, or you can keep the sampling volume nearest to the probe and or shift the baseline. Also, if you can decrease your sector size and depth, then also you can decrease the aliasing. Coming to the continuous wave Doppler, as there are two crystals in continuous wave Doppler, there is no need to wait. It means there is no limitation of pulse repetition frequency and also the Nyquist limit. And higher velocity flows can be determined in continuous wave Doppler, but the drawback is that you do not have the sample volume, so there is inability to detect the exact location of the velocity. In Doppler shift, for accurate estimation of Doppler shift, the direction of the blood flow and the ultrasound beam should be parallel, because for Doppler shift formula, your cos theta or cos 0 is 1. So your angle should be less than 20 degree. That is, the ultrasound waves and direction of blood flow should be less than 20 degrees. So if you have angle of incidence more than 20 degrees, it will significantly underestimate the velocity. And spectral Doppler should always be guided by the color Doppler. If you can see in this figure, if you have a Doppler sample volume and the line position. So see the entrance of jet and then see the entrance of jet and then you have to align your Doppler cursor along the jet. So if your blue is the jet and green is the spectral Doppler, so this angle between the jet and color Doppler should not be more than 20 degrees. So as we know, if you have a flow above the baseline, which is flow towards the probe, and flow below is flow away from the baseline. And you can see a spectral Doppler scale and baseline position. It should be, spectral Doppler scale and baseline. This is your scale and this is your baseline. So spectral Doppler scale and baseline position should be adjusted to show the full signal appropriately. If you apply a higher scale, for example, in this figure, if you apply a higher scale than needed, it will result in a Doppler signal that is too small and it increases the margin of measurement error. In image 1, you can see jet is well represented. In figure 2, the jet is very small because your scale is higher, so which can increase the margin of error during measurement. So we have to adjust the scale. So in color Doppler, as color Doppler is also a form of pulse wave, so there is limitation of low temporal resolution. So therefore you have to keep a track on sector. So sector of the color should be as less as possible. It should be adjusted to include the region of interest only. If your sector size is bigger, the machine has to sample and analyze multiple sites in one frame, and then the frame rate will be usually low. So therefore it is important that you limit the color sector width and depth to the area of interest only to increase as a mean to maximize your temporal resolution. So the take home messages are, The orient beam should be perpendicular and in the near field for the 2D images, whereas the Doppler beam should be parallel to the blood flow. And you should always use the focus on the point of interest, decrease the depth, use zoom wherever necessary, adjust the gain, narrow down the sector width, and use the focal point at the region of interest. Thank you.
Thank you, Dr. Gegal Pruthi, for elaborating the image optimization knowledge. So many key points were highlighted, so that we don't really take things granted by doing a poor quality images. So the reason for poor quality images were neatly described, and so that we can update ourselves with that. And the topic is open for discussion.
Yeah. Hello, Dr. Gegal Pruthi. You have done a very comprehensive presentation, and there are some questions in the chat box. Can you answer these questions? One question is, can you explain aliasing once again? How it is affected by the frequency?
Yes, sir.
No.
Shall I share the slides again?
Yeah, you can share the slide and explain for the benefit of the students.
Yes, yes, just a minute. Are my slides visible?
Yes, they are visible.
Uh, so in pulse width Doppler, first of all, you should understand about the pulse repetition frequency and the Nyquist limit. So what is pulse repetition frequency? It is the pulses transmitted per second by that crystal. So pulses transmitted per second is known as pulse repetition frequency. And Nyquist limit is the maximum frequency limit that can be accurately interpreted. That is known as the Nyquist limit. And Nyquist limit is half of the pulse repetition frequency. So if you understand aliasing, in aliasing, you do not get the proper velocity and direction of flow. Why? Because you have reached your upper limit and your frequency is more. In this figure, you can see the frequency is 8 and your pulse repetition frequency is 11. So Nyquist limit is half, that is 5.5. If you have 5.5 Nyquist limit, that is the maximum frequency which you can be accurately interpret, but your frequency is 8, then you will have aliasing and you have wrap ups, and you will not be able to see properly the full spectral Doppler. So that is when you will have the aliasing coming in, and then you can switch for the higher velocities, you can switch the continuous wave Doppler for such velocities. Anything you want to add, sir?
Yeah, it's correct. So what happens in pulse wave Doppler? There is only one crystal who is firing. So before that, the next pulse is generated. It has to come back. So if velocity is more than half of the pulse separation frequency, the we can see the wraparound image, and that's why aliasing occurs. And that's what it is. So next question is, how will number of scan lines per sector affects the temporal resolution? By Dr. Nupur Bansal. Can you answer, madam? Temporal resolution, how the number of scan lines affect the temporal resolution?
Yes, just a minute. So you can see figure A and figure B. So for temporal resolution, just see that, for example, if this image you want to see, this particular point. So this for temporal resolution, if you have the beams going up and down for a complete sector instead of just this region, then it will take more time. When you have more beams, the ultrasound wave has to go up and down again, so it will take longer time to finish one complete sector and then again to start a new frame. So anything that requires more time, anything that requires more time, the temporal resolution will be less. So in M mode, if you can see, you just have a one line to scan. So therefore, just think it as a camera. So the camera has to, particularly it has to see if one point or a complete frame. So if you have more deeper structures or more sector weight, then it will take more time. So therefore, temporal resolution will be less at that particular point. Therefore, in M mode, you'd have just one scan line, and that only it has to scan again and again. Therefore, frame rate is around 2000 per second, and therefore in M mode you will have better temporal resolution.
Yeah, very true. So in temporal resolution, there is only one scan line. So all the energies related to that line. So we will have a better resolution in case of M mode in temporal resolution. And as Madam told initially, the axial resolution. So you should be very clear that axial resolution depends upon frequency, and temporal resolution depends upon this what you call scan lines. So that is very important point in resolution, because we should be seeing the structure of interest. The region of interest should be very clear, so that we can interpret it properly and play effective role in perioperative decision making. So next question is from Dr. Pallav Singh. Can you explain? Okay, again temporization. Yes, one question we have left in starting by Dr. Prashant Pandit. Can you explain something about mechanical index and how we can manage this for bubble contrast study?
Sorry, sir, I have to read about it. What is
Do you have
mechanical
any
index?
idea about mechanical index and and how we can decrease this in case of bubble contrast study? Dr. Lakshmi Patil, ma'am, can you enlighten us something regarding that, or should I tell? Actually, mechanical index is what it's basically it's the effect of mechanical energy to the ultrasound beam, and it causes mechanical damage to the tissue, mostly because of cavitation, and it happens mostly in case of bubble contrast study and more in pediatric patients. So actually this is basically setting. We cannot do anything directly to decrease it, but we can do some changes in our settings. We can reduce output power, we can reduce output gain, and we can use tissue harmonic imaging in bubble contrast study to decrease this mechanical index. And we can adjust focal zone and depth and keep the focal zone at or near the region of interest, avoid unnecessary high pressure elsewhere else, and minimize the dwell time. That all these parameters help us to decrease the mechanical index, especially in a patient for bubble contrast study. Dr. Lakshmi, do you want to add something to this? No, madam, can you tell something about thermal index that's also there in the machines? Thermal index. See, these are not Knobology and settings, but these two numbers are there in Echo machine on the right hand corner. They are always they are displayed. Mechanical index and thermal index. Actually, thermal index also it's very important, especially in pediatric patients. So what happened? It will cause if thermal index is high, that will cause damage to the tissue because of high temperature, and it's specifically important in pediatric patients. So whenever we use echo for long time in pediatric patients, sometimes that machine will tell probe temperature is very high. So for that, what we have to do, especially in pediatric patients, we have to decrease our imaging time, number one, and we should use our color flow and especially the continuous wave Doppler for minimum number of time, minimum duration of time. And whenever we're keeping the machine on the freeze mode, when we are not using it, that time machine should be freeze in 2D mode, not in color mode or continuous wave Doppler mode or PW mode. That will cause increased temperature, and that can cause a tissue injury to the, especially in pediatric patients. Moderator sir, you want to add something on this? Okay, no. Any other questions? Dr. Lakshmi, anything can you add for this?
I would like to know one more question arised from the chat box. This is Dr. Rashmi N. Can you please explain single cycle, 3 to 5 cycles, which you were mentioning related to the heart rate?
Yeah, very pertinent question.
So if we have tachycardia or arrhythmias going on, then we have to at least acquire 3 to 5 beats. Then you should not rely on just one beat, one spectral Doppler. You have to acquire at least 3 to 5 beats, and then you have to assess the uh, velocities or the gradients in that particular scenarios if you have tachycardia or arrhythmias.
I want to add in this. See, AC recommends that any patient on sinus rhythm, we should take the average of 3 regular cycles. And any patient in which there is some arrhythmia like atrial fibrillation, especially in a patient with mitral stenosis or mitral regurg, then we should take average of 5 to 10 cycles. So for sinus rhythm,
Okay,
we
sir.
should take the average of Doppler profiles of 3, average of 3 to 5 cycles, and for atrial fibrillation and arrhythmia, 5 to 10 cycles. That's just a comment on this thing.
Yeah,
Good, sir.
yeah, Muralidhar here. I appreciate the responses you have given, Dr. Anand. I totally agree with you that in the bubble contrast study, there should be the ultrasound mechanical power should be reduced, which is actually reflected as mechanical index. The most critical setting will be to lower the mechanical index from the standard echocardiography mode setting, which is usually more than 1.0. It should be reduced to less than. Um, it should be ideally less than 0.02, so
Yeah,
that
point
you
two.
get. Yeah, you get that thing. And regarding the pulse repetition frequency and the number of cycles needed in sinus rhythm versus atrial fibrillation, you have correctly replied. I'll agree. I agree with you. What all you said. Thank you so much.
Thank you, sir. Yeah. Any other question? Um, any other question?
Anand, can I say something?
Yeah, please, madam. Go ahead, madam.
Yeah, Gegal, it was uh, as usual. It was very nice presentation. Difficult topic too. Uh, see, I would like you to bring that slide again. Nyquist limit. This little bit of confusion I would like to clear. And regarding this M mode, there is high frame rate only at one point. That is very important. So
Yeah.
you have to move the that line of insonation at mitral valve, at tip, at chordy level while looking at SAM. We do move it. So one point only and very high frame rate only at single point. That is one important. This here you have written frequency 8 in the last where there is aliasing is happening. Third phenomena.
Yes, ma'am.
Phenomena of aliasing. This frequency 8, which is this frequency?
Frequency of the probe.
Okay.
Yeah.
Because by all this, what we mean clinically is whenever velocity is high, frequency 8, I mean, we don't use that much of frequency for 2D, isn't it?
Yeah.
This was just a hypothetical example to understand.
No. The important clinical orientation for this, I would like to give
Yes.
is that whenever there is high velocity at that point across the different valves, for example, it is more than 1.5 or 2, then pulse wave would not, or 2.5, I just forgot the limit. You can
1.2. It
you
is
can calculate
1.2
1.2.
meter per
1.5.
second.
Yes. So that time it would alias, and you would not get the correct gradient over there.
Mm-hmm.
So that time either you have to shift the line or convert it into the uh,
Continuous.
continuous wave. So whenever, and why one has to put color before? Because if it is a quiet color of red or blue, obviously there is no aliasing. We can just diagnose there and then. But when there is turbulent flow, this is for the students I'm telling, whenever there is turbulent flow, one should put continuous wave Doppler, because turbulence means high velocity across that structure. So naturally aliasing would occur when we see color aliasing. So one should put TW and get the proper gradient. Nice.
Yeah.
And mechanical index was a very good point. You all have brought it, and this is very important while we, because when we inject these micro bubbles, these are the chemical we are injecting, and if the sound waves are also high and this chemical is injected, naturally the myocardium is going to get damaged. So mechanical index must be reduced while doing not your saline agitation studies, but when you introduce some other chemicals like Sonoview or which is that another agent I forgot. These microbubbles when we inject, because they pass your micro agitated saline would not pass the pulmonary circulation, but this will pass and it will delineate the myocardial structure of LV when we inject these bubbles on right side of the heart. And for
Yeah.
that, this has to be reduced to 0.2. That's a
Yes.
very good point, very good point, very important point.
Yeah. True, madam. Very true.
Mm.
So, madam, there's another question from Dr. Kavya, that what is tissue Doppler imaging? Dr. Gegal, can you explain about what is tissue Doppler imaging?
Yes, sir. Tissue Doppler imaging is for the for velocities of the myocardial or the tissue motion. So here, low amplitude, high velocity signals are filtered out, so that only high amplitude and low velocity signals retain. So particularly it is for the myocardial basically motions. So therefore, your high amplitude and low velocity signals retain. Uh, yes.
Yeah, very true. This is tissue Doppler. And for image interpretation, the important point here is it's very much angle dependent. So the area of the angle should be quite aligned with the Doppler beam, so that we can find out to some conclusion about various velocities. It's very useful to find out E prime and for diastolic dysfunction and for volume status. So tissue Doppler is a very important modality in this regard. And regarding tissue Doppler. And one comment, madam, you told in starting of your thing that for high resolution, the image, what you call the region of interest should be near field. So how can we improve the region, this quality of image if we are not able to keep the region of interest in near field? Or in the interest of students, how can we improve our image quality in that case?
We can reduce the width, sir, sector width.
Yeah, we can reduce the sector width and we can use focus. The focus is very important thing. Can you explain how the focus works and anything about it? That how focus will help us to improve the quality of image?
Sir, it increases the contrast and the lateral resolution basically.
Yeah, very true. Focus basically it narrows the beam width. So it will increase the lateral resolution. What happened in our phase array probes, the different crystals elements are activated with time delays. So there is a delay in time in activation of different crystals so that the wavefronts converge at a chosen depth. So that will help us to get a proper image. And what happened in this case, the near field, the Fresnel zone is increased, and we will get the beam is quite convergent, and we'll get a good image in these particular patients. So that is another one important thing in this case. And AC recommends for any calculation we should use zoom mode, and then we should calculate. So zoom mode is also very important. And the one important thing in zoom mode is zoom can be done in two ways. One, when we are taking an image, and pre-processing zoom is very important. That will help us to increase the temporal resolution. On the contrary, in the still image, when we do zoom, that will just enlarge the image and it will not increase the temporal resolution. So that is very important point in case of zoom that I want to highlight in this particular thing. And any other comments from Lakshmi madam, Dr. Lakshmi?
Dr. Gegal, can you just briefly talk about that matrix array? We spoke about the phased arrays and other things. Could you briefly tell us what is matrix array? Because it is the upcoming version for these 3D.
I have little information about 3D, ma'am. I'm not good at it.
Probably it is related to the piezoelectric elements which are arranged in multiple rows. Can be either linear or curvilinear or curve. So which are used for this 3D imaging.
Yeah. Any other thing?
No, I think so. Most of the topics are covered.
Yeah, and, can I ask one question? Dr. Gegal, there is one button in our machine that's called compression. So can you enlighten the students how it helps us in improving the image quality? One knob is there that says that compression. In other words, what is dynamic range compression? How it help us to improve our image quality? So this compression button, dynamic range in cardiac ultrasound is basically the range of echo signals that ultrasound wave displays, and it tells us about the what you call the echo signals from weakest to the strongest echoes, and it measures in decibels, and basically tells us about how many what is the range of echo signals. So if we by compression, what we do, we increase that dynamic range. So with high dynamic range, will cause less compression and will show us the more shades of gray. We will get smoother image and better tissue delineation. And on the contrary, with low dynamic range, what happened when we increase the compression to more, we get the few shades of gray and higher contrast. So the practical applicability of this is that whenever we have to use, so instead of seeing the numbers, that decibels 40 or 50, we have to set the compression in such a way that that the blood pool looks dark and myocardium is medium gray and the pericardium or the valve structure is bright but not blooming. So that is the importance of compression. It's very useful to improve the image quality, and especially it's very useful in 3D echocardiography also to see that we have the proper image quality. So that is about compression, dynamic range compression. Any other questions from audience or any comments from faculty?
That was a lovely session. Can you hear me?
Yes, sir. Yes, sir.
That was a lovely session. Thank you so much for joining us. I would like to thank Dr. Gegal for that excellent talk, and thank Dr. Lakshmi Patil and Rajan, Anand, Sanjeevani, and others who have participated in this uh, discussions. And thank you so much. We'd like to see you next week for the same session with a different topic. Thank you so much and all the best. Enjoy your Sunday. Thank you. And there is a announcement about the IACTA TE workshop. I request Swastika to play that one, please.
Sure, sir. So thank you to all the trees present here. Currently is really glad to have all these brilliant people together in the session today. And I hope to have you all here once again in our session. So with everyone's permission, I'm concluding the session in here for today. And looking forward to host you again. Thank you so much, everyone.
Thank you. Thank
Thank you. Have a good day ahead.
you.
Thank,
Thank you.
thank you.